I thank you for attending, and we are holding our roundtable discussion regarding Bill number 70-33 COR, an act to amend Section 41105, Chapter 41, Article 1 of 17 Guam Code annotated relative to the creation of a registry for individuals with disabilities. And to comply with the open government law, I just want to note that we did issue the first notice on Thursday, April 30th, and then the second notice for the public to attend this meeting was issued on May 5th. And that's to meet the 48-hour requirement. So without further ado, I would like to first of all welcome all of you here. I thank you for taking the time to come again. This is the second time that we're discussing Bill 70. And Bill 70 was referred to Vice Speaker Cruz's committee, and he held a public hearing on April 16, 2015 to receive comments and testimonies. Those testimonies are available for your review, and I believe we've given those to you. At the hearing, Guam Police Department, Mrs. Roseanne Ada, Director of the Guam Developmental Disabilities Council, Mr. Angel Sablan, Executive Director of the Mayor's Council, Mr. Ben Servino, Director of DISID, Mr. Sam Elisugam from Guma Mami, Ms. Cynthia Mesa, and Ms. Mary Therese Edgarl they were present at the hearing and provided valuable testimony on Bill 70. The discussions at the public hearing were varied. As far as support for the bill, Mrs. Ada, in her testimony, suggested amending the bill to include the definition of developmental disability, which we have amended in the bill. And copies of the amended bill are also available, and I believe you have them at hand. Today, the goal is to bring together the stakeholders to further discuss Bill 70 and to ensure that the concerns that had been raised at the public hearing in April and the dialogue from today's roundtable meeting are incorporated in Bill 70. And so I continue to support the concept of some kind of registry for individuals with disability and the need for better communication with our first responders. Although we are not sure of the number of incidences that occurs in Guam when a first responder and a person with disability cannot communicate for whatever reason, we don't want to wait for an unfortunate circumstance that could result in a potential volatile or even a fatal event. So thank you again for your presence today. And I would like to just start by opening up the floor to maybe Carol, for you to go ahead and provide whatever input you would like regarding Bill 70. And state your name for the record.
My name is Carol Darlow, and I am the chairperson for the Guam Statewide Independent Living Council. I also have 2 members of my family who have disabilities. Mm-hmm. Our council is in support of this bill. There is a need for a central registry, not only just for cases of fire and ambulance and stuff, but in cases of natural disaster. Mm-hmm. I think it's imperative that we have a central registry rather than many splintered registries, as there have been several attempts by different organizations to develop a registry. In the bill, it says it's voluntary, so I don't believe that this is an invasion of privacy, because everyone has the choice whether they wish to register or not. The only thing as far as that is concerned is when our children reach 18, they should be notified, that they need to re-register if they wish to become a part of that registry, unless they remain a legal guardian of a parent at that time. An important part of this bill, too, is the training of first responders. This is essential, not just the registry part. It's essential that when the first responder goes to an address, that they know that there's a person there who has disabilities, especially if that person's disabilities is developmental or emotional. Because in this case, many of these persons with disabilities act in untoward ways, and many of them are very sensitive to the number of people that approach them and the way in which they are approached. So training should be an essential part of this bill. And again, as I mentioned, the Council for Independent Living is in support of this bill. And as far as who is to implement this, it's really important that I believe that it resides with an agency because of the constancy. Many of our councils have difficulty meeting at times, and we need something that's always there that people can depend upon, and the agencies are the appropriate, I think, site for this to be tasked. As a parent and grandparent of persons with disabilities, I belong to several organizations, and we have been concerned as groups of parents that there is nothing in place, that it's imperative that we get something in place now. And because of all of the dissension of who's going to do it and how it's going to be done, parents are now banding together to try to address this on their own, when actually this should be something that should be centrally done by our community to meet the needs of individuals with disabilities. Thank you.
Thank you so much, Carol. And I really know what you mean, because I too have my oldest grandson who is autistic, and he's about to graduate from high school. So clearly, I just know about the need and the sense of concern that a lot of parents and family members are, have expressed about what will happen when they're in a situation whereby they may just be a bystander, and there is something that potentially could be volatile, and the way they respond, because they don't understand, right, and to the first responders may create something that would endanger them because of the lack of communication or any other thing. So thank you for sharing your concerns and the concerns of parents. So we also have Sam. Sam, thank you again for coming back.
Thank you, Senator. Good morning.
Good morning. Yeah, when it's red, it's there.
Okay.
There you go.
Yeah, thank you. And I really want to thank you for being proactive on this issue. I think this is not something unique to our community here on Guam. This is an issue that's been going on nationwide, and we've read in papers and we've seen online news release regarding what can go wrong in this situation. So I really want to thank you for trying to be proactive. I'm just going to share some of the things that I've kind of shared in my testimony. My initial stance on this bill was it's a very useful tool. It's something that I think can benefit our community, and especially the individuals that we work with, and those are the individuals with disabilities. As I shared in my testimony, because it has something to do with individuals with disabilities, I kind of took upon myself to initiate discussions within the groups that I work with. So I talked to some of the individuals and try to get their input. Unfortunately, some of the people that we're talking about are not here. It would be very beneficial if they're part of the discussion also. But from my discussions with them, I kind of get the sense that there's still some resistance to this, and that the resistance is maybe a result of several factors. I think I've kind of pointed out this. There's still that lack of trust or confidence in the government, especially when it comes to people's confidential information. So there was from my discussions, I can really tell that the people that I would think would be interested to be on the list, who can benefit from the list, were kind of resisting it. But still, I still see the intent of the bill. When I look at it, I think it can be a tool during disasters. It can be also used for crisis management. I am not sure if those were the intentions, but yeah, that's what I get from the bill. So in preparation for my testimony last month, I kind of just did a brief, not very thorough, just a brief research, talking to some people also, and I must admit I talked to some people from off island in the States also. I was presented with different models that other communities use in these situations also. And so that kind of, like, my discussions kind of took me off that my support for the bill, and kind of moved me toward looking at other models. And I think I presented, I see in here that the printouts that I provided during the testimony these were just examples, right? So the issue of one of the things that we discussed in our groups were it's a voluntary thing, and what I was taught, or what I was taught in the groups was that yes, we can say it's voluntary, but if we as consumers see that it's gonna get us ahead of the line, then we're kind of forced to be on that list. We're gonna register to be. Let me give you an example, and I think I kind of used this example when I was discussing this with one of your staff. Let me the example of the homeless shelters. It's a voluntary program. You come in as a volunteer, but I was very glad to learn that some people were under the impressions that if you get into the homeless shelter, you'll get housing first from Pura. So even if they didn't need to be in the homeless shelter, they decided to register for the homeless program because they thought it was gonna get them ahead of the line. So they were kind of forced to be in there also. And so people are, or at least the individuals that I talk with, they think that if they see that those who are on the list will get the services, then I guess it will force them to be on the list. So that kind of throws that voluntary issue into. And then again, just looking, I've been in this field for quite some time. So I tried to look at some of the things that we are doing, and we were doing that kind of work for our community. And I'm just going to share with you an experience from Guma Mami. At one point, Guma Mami was providing the case management services for the Department of Integrated Services for Individuals with Disabilities. That, I think, by Guma Mami providing the services, the case management services, we kind of took care of some of these issues. When in times of disaster, again, because we were a non-profit organization, we were able to do things that government cannot or is not able to do. I mean, and I'm talking about like working over hours, being called in any time on a 24-hour basis. So I feel from my experience at working in that program, that kind of took care of disasters and preparedness and recovery. That kind of took care of crisis management also. And I think that's what's needed here right now, is that right now there's the department DISID is taking care of their own case management services. And I think because of course it's a government, not a department, that kind of took away the ability for them to respond at night, to respond early morning hours. So again, I'm just bringing that up. If we can look at that model again, yeah. And I'm sorry, go ahead. And this issue, I mean, like in times of disaster, yes, this was something that Guma Mami saw as a need, and we did apply for one of our main issues with during disaster was the accessibility of the facilities and transportation to those facilities. During that time we had a working model, because we were working with the different mayor's offices. We were able to get people to shelters in times of disaster. But then we've been trying to apply for a grant to build an accessible typhoon shelter for individuals with disabilities. Unfortunately, our grant application didn't go anywhere. Yeah, so all I'm suggesting is that we look at what worked in the past and what's working now, yeah, and then incorporating those. And again, I'm going to echo the need for training. Yeah, so yeah, I think there's really a lot of need for trainings for our first responders. So I guess that, yeah. So thank you.
Thank you so much, Sam, and that really gives me insight to the concerns that had been raised by your clients, and especially even in light of the fact that it is voluntary. So let me just, again, I'll look through the bill to ensure that the use for this registry is clearly, primarily to assist persons with disabilities, individuals with disabilities, specifically in time of crisis, in time of for their first responders, when there is a need for that. That's a primary use. Now, I know the concern there was that you used the example of, there was a list that was being compiled for homeless shelters, and for some reason that was a list that was perceived to provide an opening for in case that there were homes that would be available, and that's why they felt compelled that they would, even though it's voluntary. Right, I'm going to look at the bill again, because our intention here for the registry is really to protect the individuals who voluntarily make their names there. And it's very, you can't use it for any other purposes. Otherwise, you would be violating the law. You can't use this registry to provide access to other, like for example, you said to get in front of the line, to get access for parking permits or whatever that is. The intention when I crafted this was really voluntary for those who have concerns, to respond to parents who had a concern that if their child was out there somewhere and a crisis arose, that the responders, the first responders, had some kind of information that would help them address that child or that individual and to meet the specific needs of that individual. So to tighten the language, I would tighten the language here, but there is, I know what I'm hearing is that there has to be a centralized registry for individuals with disabilities, and that would then give them access to services and perhaps the housing, that their names would be there, or other benefits, right? But the intent of this is really in the crisis management, in response to disasters, the protection of that individual, and to provide that information to those who are responding. That's the primary intent of this bill.
If I may, Senator, I forgot to mention one issue that was brought to me, and I think one factor in the fear was then the access to the information on the registry. If we're gonna make it accessible to different agencies and different people, that kind of scares a lot of people.
Right. And so it's voluntary, right? It's voluntary. So if they have that fear, the law doesn't, the bill does not require them to be a part of it. I can give all the assurances, right, about securing the database, securing, our servers, and so on. But I cannot go 100% because we know that there are all kinds of, anything can happen, right? It's voluntary. It really is. And so, go ahead.
Yeah, so I guess the question I was going to ask is, within the system, are we able to indicate which agencies can look at our registry? So if I'm a consumer of DISID and I want only DISID to access the information, can we do that within the system?
So the way this is, okay. Yes, go ahead. Yes, go ahead.
My name is Evelyn Menabus, and I'm here on behalf of our director, Benito Servino. And in regards to your question, Sam, the intent of the bill, as Senator Underwood had just mentioned, it is for the crisis intervention. It is actually for that, and we'd like to first start small, maybe, and everybody on the table is trying to get together to see what is the best way to do this. How do we protect all the other issues that everybody will come up with in terms of confidentiality, in terms of who's going to be served, how do we serve this? The logistics of it all is very important. And so I understand your concern, and I think that if we stay focused and try to see if this database does help and work in our first natural disaster that we may have, and if it does, then we can come back to the table and build on more of what it is, the current need or the extensions of those needs, because everything is important and everybody will want to come to the table for different reasons, but I believe that we are supporting this because of the mere fact that there probably isn't one centralized system that the first responders can respond to or get access to.
Right.
And all it is about accessibility. All it is about saying, okay, this is so-and-so John Doe over at this place. How do we get the fire over there to help them to get to safety? And if we stay focused on that and know that that is the mission for this intent of this bill, that is why we're all here to support it in that regards.
Yeah. Thank you. Thank you so much. And you also wanted to provide information and state your name. Yes.
Assistant Fire Chief Darren Brewer.
Okay.
excuse me, on the bill, I support the bill in its intent, but to look at developing a registry, it's been tried before to where trying to do a registry for SNPs, and SNPs is for special needs children, and the idea was that they're going to provide a registry and 3x5 cards with the information at the stations and at the 911. This doesn't work because the information is not there. We don't know about the patient until we get there. Then to go through a card file of people, it delays our treatment. So I would not recommend doing a registry locally that would create more problems, because then you got HIPAA issues, because you're dealing with healthcare information. You can't have that information out. It has to be secured. It's a huge fine if you violate that. So it's something that you really don't want to get into. The alternative that I would suggest, because this is something where, what if you travel to the States? You want your information to be available to any responder that's out there. So there are registries online, rescue access registry. I meant to bring it today, but I was busy this morning and ended up leaving it at the office. But it's an online service that creates barcode tags, sort of like medical alert tags. And these barcode tags will have a QRC code there that can't be read by anybody, and it can only be read by an app that you put on a tablet or on a phone, on a smartphone. These applications would not be available to anybody but first responders. So this intent for this registry would be a good idea to redirect the information to be where we could make the app available to all emergency responders, the police and the fire. And that way, if we come onto a scene and somebody has a barcode tag, it's either an ID card in the wallet, or it's going to be a tag that can be worn as a piece of jewelry, like any kind of medical alert tag. We scan that code, and we'll get all the information we need on that person. And it wouldn't just, serve the DISID population, but also would serve any of the other population on Guam that would want to have that information, like athletes who are riding their bikes on the road to get hit by a car. Their information can be all on that barcode. So this would be a kind of a registry, and it's a voluntary registry. They go in, they pay a monthly fee, or a yearly fee is actually what it is. It's low cost, but it's a yearly fee to provide their information. The other benefit of this barcode system is that they have an ID number that's right below that barcode. So if you, as a layperson who responds, and you're there first, and there's no emergency responder there to swipe this card on their smartphone or on their tablets that they have, you'd be able to call 911, give that ID number. The dispatcher would be able to enter that into the web service, and they'd be able to extract all the information they need and be able to give that information to the responders as they're arriving on scene. So it'd be more effective and be available nationwide.
Right. So that we are actually talking about the same thing.
Yes.
Because every child that registers here has to have an identification. Mm-hmm. And so you had given us insight to how that can be done. But this is within the
mm-hmm.
bill. The information is governed by HIPAA.
Right, and this is a HIPAA issue.
It's a HIPAA.
That's why the code, the application,
that's right.
is not accessible unless
that's
by
right.
our 911 system.
Exactly. Yeah, and the only ones who can access this
is the ones with permission.
It's the ones with permission.
Correct.
And they have. So when something occurs,
mm-hmm.
right, and there's some kind, and you respond, you see that there's an ID number
right.
or something, then you actually would scan that, and you would then get that information from that.
Correct.
Exactly, from that database.
Correct.
Yeah.
And it already exists.
And it already exists.
Yes.
So we certainly will explore that, what
mm-hmm.
you had noted, and we need that information from you.
Okay.
But it's the same concept.
Correct.
What we are...
In it.
Yes.
Exactly.
But what we are trying to...
Right. And
right.
what it does, it solves the problem of getting the accessibility to the first responder.
That's right. Exactly. Yeah. And that's we're on the same page.
Right.
Okay.
Okay. I just want to bring that out because it was
it
talking about creating...
we are not talking about having small...
Right.
Small cards are paid. But really it's that there is an identification for that volunteer,
mm-hmm.
that child, and then there's some type, and we were trying to figure out what that would be, and I believe that you gave us insight to how
mm-hmm.
that might occur,
right.
so that it's, when that's scanned right away, the information that is needed to
Correct.
meet the needs of that child is right there,
Correct.
or that individual.
And if the information needs to be updated, it's done
That's
over the internet, and when they swipe it, the update will be there.
That's
So they have the contacts, emergency contacts, healthcare, everything. is right there.
Everything, yeah. Go ahead. Carol?
So, one of the concerns I have in regards to any kind of a tag they would wear or have is that many of our children or people with disabilities are sensitive to things on their body and will not keep them on. And when you're talking, it wouldn't be limited also to children. We have a lot of adults with
Who also-
Alzheimer's and dementia,
Right.
whom this would serve as well. And many of them as well do not keep tags
Right.
on or bracelets or anything. So, and I don't have a solution to
Yeah.
that.
I know, and I think this is not, we're not the first ones who have been concerned about this, and this is where we need to do our research about the different ways that the identification can be provided to that individual, because I do know with my grandson, he didn't want anything foreign, any kind of bracelet, will not, any kind of around his neck or whatever that is. So those are things that we need to further research in terms of what works best and what had
Right.
worked, because this has already been established nationwide. And I like the idea that it's not going to be limited, because our individuals with disabilities are free to go everywhere else. So, we would want to ensure that they're not just protected within the confines of our island, but when they travel, that, if that exists at national level, right, that they would also have that type of protection.
And I think
So-
the organizations that do this, they take into account, like you're saying, the ones who don't want anything on them. So it's available in all different forms, even to where they can have a tag that's interwoven into the shoelaces.
Wow.
Yeah.
That's
And yeah, so you can actually take the
Very-
tag, and when you tie the shoe, you can have it right there on the top, and it can be accessed. And they do that for like runners and athletes
Yeah.
that their information is
see.
right there.
Wow, that's interesting.
And then they got necklaces, they've got the bracelets, of course, they've got tags to go inside the wallet. They can, any way that they can think of to where the person can have it on their body and accessible by the EMTs. Because if someone's unconscious, unresponsive,
Yeah.
and we arrive, we open the wallet to see
That's
who they
right.
are. Yeah.
Right.
And then we'll see the card.
Right.
So then, first responders would be trained to look in specific places
In
for
the
these
RDR,
things.
yeah.
Yeah. It would be more
And
than
they
one
should
place,
already-
right?
And
Yeah.
then if we were to do this system, then that would be part of the additional training we do, making sure that awareness training is done, and even to the police officers, because it would be new for the police officers, but not for the EMTs.
That's right.
Yeah. And then we would just have to make sure that whatever cost it is for the application to be available to the enforcement, be available, because then it'd be a secure application. No one else can have it, and they'd be registered and sign off on the HIPAA agreements.
Right.
That way, any violation,
There's
They'd be responsible.
Very strict. Mr. Costello, did you want to? Go ahead, and please state your name.
Yes, Leo Casil, I'm the Deputy Director for Public Health and Social Services. It's on, right? Yeah, and our situation isn't as detailed as you're going into, but we do like the what you're doing on the intent, Senator, and of course we support it. Now, where it can be useful to us, we have a program under our benefits section, the public welfare, where we give benefits to people with disabilities, and there is a process there that used to be to where it has to be cleared by DISID, right? So what happened when they left there, it's taking longer, because now we have to get our own board and a doctor to verify. So maybe this registry, not as detailed as what you're looking for, is just to reconcile the fact that that individual that we're trying to review for disability, this would help expedite it, perhaps. The registry, and that's about the intensive that we have.
So again, to go back, right, to balance this off, so it's voluntary.
Yes.
Right. So, and this is where Sam had expressed that So Sam, when it's voluntary, so part of what public health is noting is that for them, because they want to expedite the provision of benefits to that individual with disability, if that person is registered here, and this is probably your concern, well, it's going to put them in front of the line, but in this sense, it's about providing the basic need of that child, of that individual, right? It's not for that extra benefit that would, where there's a contest, but what he's stating is that it would then give them and help them to process the application. And that's basically, you know, but it's voluntary. So not everyone's going to be on there,
Yeah.
right? And, yeah, go ahead.
Yeah, and I think, yeah, that's a good point. It just facilitates the process, right? It's not actually providing additional services. It just speeds up the process. So that's okay. That's a one.
We'd have to look into their, what's the sickness, their individual disability, so
Yeah.
that would be already the
That
main
would
thing.
already, yeah,
Don't
with
worry
their,
about
it would flat, and then, you know, then it would kick in when they come in and apply.
Yeah, and I think like one of the good thing about the program that he's mentioning for me
Yes.
is that it's inclusive. It's not only for individuals with disabilities. It doesn't single out a certain population. This is like any community member can register, right?
Right.
So yeah, so
Yes.
it's for the whole community. It's not only for individuals with disabilities. So
Yes.
yeah, I think that was a kind of a factor in that also, is that this list was going to single out, it's going to create a list of individuals with disabilities. But if we have a program like that where it's more inclusive, I think that's good.
Okay, so let me just get back to, because now we're expanding the population. So what you are suggesting is the database for anybody that has special medical needs. They may not be fall under definition of disability, but you know, they may have special medical needs that would need to be addressed. So you're talking now of a more global registry.
Correct. I mean, because of doing this registry for DISID, which is very important that we have that information out to them. It's a certain segment of the population that if you're to offer in the information for this website where more of a global population can enter it voluntarily and pay their yearly thing for it, then that would benefit a greater, a broader spectrum of our population that really need it. Because right now, medical alert tags are not very commonplace on Guam, and they're all they do is give us an alert that they have a certain condition. But especially with language barriers, communication issues there, having a barcode that we can scan that would give us your medical history, any allergies, emergency contacts, your insurance information, all that information is there. It can be inputted into this, and then any special considerations that you have, disabilities, the heart problems, epilepsy, everything's going to be there. It would allow our providers to give the proper care before we get to the hospital, and then when you get to the hospital, they have more information about your history, and they can give you proper treatment. It would be so much better.
Carol?
Yes, I can see where this would be very useful in the case of natural disasters, because we have a number of persons in our community who rely upon oxygen. And these people, it's really essential for some of them to have it continuously. So for first responders to know that in these cases that these are individuals that may need some kind of assistance. And some of these individuals live alone.
Yes. Okay, so,
That's the other half of the database, like Mr. Cassell was talking about, having a list of people that have special needs and to identify them to where it comes in time of disasters. That list can be looked at and then activated for the emergency shelters. like you say, the ones who live alone that can't make a call, then we'd be able to follow through with sending a unit out to that location to make sure they're good or they need to be transported to an emergency shelter for the storm. Because right now we don't have that. We do emergency shelters setups for medical shelters for the storms and stuff, and that's in the plan. That's already been planned for. It's just the access to those individuals that are not able to communicate with us at that time, to be able to have like just basically their name, their disability, their location, and then we can do an outreach to make sure that they've been contacted, they've been taken care of properly, and that they don't, end up in a situation they don't want to be in after the storm.
Mr. Servino, state your name.
Day. For the record, my name is Ben Servino, the director of DISID. I apologize for my delay. I had a conflict in my schedule, but I'm here, and
Yes, thank you.
I really want to share with everybody that I feel that the information we're gathering from here, from everyone, is going to be really incorporated in this bill when we implement it. And it's like you share it, community responsibility, not just DISIDs. And we're working very closely with the mayors because they know their constituents in their community. They know who is out there. But again, the issue here is, again, voluntary. And a lot of people feel that it's not voluntary, and that's where the issue comes, and they feel, that their rights are being violated and everything. But no, it's all voluntary. And if they know what the true benefits are, I think they'd sign up, because they'd be left without all the resources and the accommodations they're going to need. And also the information in the community that's, existing, all the events that are existing, all the grants that are coming up, they'd have access to all that information. So I feel this registry will really provide more than just the demographics and the information, but it's going to provide the accuracy of the demographics. So when we apply for grants, we can use this information.
Okay, so the statistics from the voluntary list would be helpful for grant.
Absolutely.
For those purposes, with no identification.
Right. It's the numbers.
It would be the numbers.
Yeah.
So, I think the struggle the challenge that we are dealing with the information that's being provided, including what you had noted, Sam, is really the use of the information, right? So I had noted before that the concern for those who are hesitating to participate is, one, the confidentiality, and whether, even though it's voluntary, the use of the information, other than to provide information to the first responders, that people may feel compelled that they have to do so if the information from that they're, information from database will be used for giving those who had registered information about events and so on and so forth. So that, I think, addresses what you had concerned, what you had noted. But I'm just going to tell you, it's voluntary. So I'm hoping that when you have heard the concern of a grandparent or a mother, concern of a grandparent, and the first responders, and the sense of helplessness that sometimes they encounter when they don't have all the information for the person, that somehow that would help to convince the importance of this, for us to collect the information for those who want to participate, to at least establish it for them, who want to participate in the program.
Yeah, then if I just want to share, and I think, like, from the beginning, all I was pushing for was a working model, something that addresses some of those issues, and I kind of presented what I found, and now I've learned of this, this new, well, I'm not sure if it's really new, but the model that they're using for me, it doesn't, I'm very comfortable, and it doesn't also specifically target the individuals with disabilities. That's a community resource, so it's open to anybody. Right?
So your suggestion is to go with a model that opens up to other members of the community that would want to be a part of it. That's
People
your
with special
suggestion.
needs.
Anyone with special needs, not necessarily under
Yes.
yes, okay. All right, I hear that. Yeah, that would be, okay. That's a very important piece of information. Carol, did you want to add?
Yeah, I hate to keep coming back to this, and that is the training of first responders. It's really so important because not every individual with special needs or disabilities requires the same type of approach. And I'm real concerned. I come from a background where I've had family members with dementia and on the autism spectrum. And in both of these instances, there's a problem of what's called elopement or leaving the home. And we've heard in other communities, it's very common among children with autism, even young adults and more, in other communities where there's been a problem with law enforcement and things, when these individuals are found wandering the streets, and some of them become very aggressive when they're approached because that's why it's important for training to recognize what characteristics do these people on the spectrum have, because most of them do not relate well to people. The least thing they want is people around them. So when we're training, we need not just a universal model here, but specific to different needs of different individuals.
And I agree. Part of our training in our EMS, from the initial training and in recurring training that we do what's called therapeutic communication. And it's a broad spectrum. It gives them an idea of how to approach cultural diversities, how to approach different types of medical issues, where, in certain cases you're going to be a little bit more authoritative in your approach. In other cases, you're going to be a little bit more diminutive in order to get the patient to respond to you, to get the information. On the responder side, the fire department with the EMTs, our intention is not to be authoritative all the time, but we need the patient to cooperate with us and to communicate with us. So we change our approach as needed, whereas I do notice that with law enforcement side, because of the 99% of the time they need to be authoritative, they don't understand how to all of a sudden become a little bit more complacent to allow that person to have the space. And that training is important for them. And on our side, we have outreached where we're focusing on certain topics of that and getting more detailed into certain of that communication issues. Where we're reaching out to different parts of the community to bring enhanced training to our personnel. So we'll be covering that over the next couple of years or so, and that'd be something that would be continued.
Okay, let me just jump in here. I think that the training has been emphasized again and again. I think, Ben, you have something to say about that, right?
DISID has been conducting trainings, disability awareness trainings for all police personnel. And I've been doing it in a number of the other precincts, starting in Dedido, and we've had personnel, even officers that have gone through these awareness trainings, teach them how to effectively communicate with people with various disabilities. But I've just been made aware that the Department of Justice is developing a disability training for police officers, because they have found that a number of individuals with disabilities, even the transgender population, has been violated as far as been discriminated. But individuals with severe, profound disabilities like autism, they've not been effectively communicating with them, and then they've been mistreating them, like you're saying, using force, and they don't recognize that they have that disability. Right. So the Department of Justice is currently developing a disability training just for the police department. I've even got some manuals for other trainings that they've conducted, and other private companies have conducted, and I use that in my training when I go to the police department.
Okay, so for purposes of the bill, we didn't really make explicit the need for training. Is that something, because we had just assumed, right, that the training would be a part of that. Is that something that you're suggesting we should make explicit through a a statement here that it would be mandatory for all
Yeah, for me, that's one of the things I was going to suggest.
to.
Yeah, if we can incorporate in here.
Yeah.
Okay.
training.
We would
Make
have
it
to have a, especially if we do the barcode thing where it releases information.
Right.
Part of the training has to be the proper use of the information and where that information goes.
Okay.
They can't just access it and then share it. And
Right,
if they're not aware of
right.
HEPA
Right.
regulations, they
That
need to be
part
made
of
aware.
it. Yeah,
And then
part
the-
of the,
Then to go along with the training with the therapeutic communication, cultural diversity is good.
It really needs to be quite detailed and not generic.
Right.
One of the
Right.
concerns of the autism community, and right now we are in the process of trying to do our own education with early responders because we're very concerned about this, is that there are specific things that first responders need to know. And they may differ than from the general public and other people with disabilities. And this is a big concern to parents who have children on the autism spectrum.
yes. There are different ways. The range of when you're talking about being authoritative versus, just giving them space and so on, it really varies depending on the spectrum where they are at with it. And so I do agree that, what has also been suggested when I met with CEDARS individuals there is that the training can't be a one-shot, that there has to be refresher courses every so often that has to be specific, because we just know that, we can go to training, but when do you really put that into practice, right? And so you don't do it every day because it doesn't happen every day. So it's very important that there has to be a system for the training not only to occur once, but there's refresher and also the opportunity for guided practice, and all that
Senator-
we know as educators. Yeah.
Senator, I want you to know that I've been communicating with CEDARS on this, and we're developing a curriculum that could be used at GCC for all the officers that go to the academy, and then it will incorporate all these other features, including the CLASP, the cultural and linguistic appropriate language that needs to be incorporated in it. So we are in the process of doing that, and under public law, DISID is mandated to certify these trainings. So already that exists.
Very good.
So I'm just working on the structure right now and the infrastructure and the module. So we're working with
Very
them.
good, very good.
That'd be good training then, not just for law enforcement, but for fire.
For
and
also for
and then
for
creating continued
all the
education.
First responders.
Absolutely. They're going to
Yes.
provide continuing credits, and also there's going to be a fee, of course. And I spoke to the chief of police, and he said they have budget for training. So I assume also the Guam Fire Department and other first responders would have that opportunity to
Yeah.
apply and take these courses.
Yeah.
Very good. So that really should be incorporated as part of the language of the bill. Yes. Okay. Sam? We will reach out to them. So, do you have?
I'm in the early stages of reviewing that.
Okay, you need to state your name, and then so we can put.
Okay,
you on
my
the
name
right-
is Edmund Cruz of the Guam Client Assistance Program and the State Rehabilitation Council. I'm, wearing two hats. I'm in the early stages, but I support the full intent of the bill. Citing the fact that in 2004, in Katrina, New Orleans, a hard time looking for people with disability during that flood, right?
Yes.
Okay,
So
so
we want
I'll provide testimony at another time. Okay, thank you.
Thank you very much. Okay, so I did hear very good suggestion. Thank you for everyone's input. Training has to be incorporated. You've given us an idea about how the different identification. We'll need the information. I can have my staff do the research. I think that kind of addresses what we were struggling with in terms of, okay, how is this going to happen? Are they going to, the identification of the individual, right? So good idea. It could be on the shoelace or somewhere, so it depends on the individual. But I thank you so much for just supporting the intent of meeting the needs of individuals with disabilities. It's not just our children, but also the adults. And now we are also concerned with those who have special needs, medical needs that we may need to open this up, especially for here and so those are big considerations for the bill. And we'll take all of those into consideration and amend the bill accordingly.
Not sure if we'd have to include in the bill at least funding or for public education.
Yes, for public,
yeah.
Right, and that would be part of that, what I had set aside, right? But we will also explore the other resources because there are federal grants for which we can apply, and we'll also work on that. But public education is really important. What's the point of having a service that no one knows about it or doesn't understand it, right? There's no point. Okay, Carol?
As I've talked with other people in the community about this bill, one of the things that's brought up is accountability, which is something that it's always brought up with whatever you're talking about. Is there anything in the bill that or can we put something that really addresses the accountability, that this is going to happen and that there...
Timeline. Okay, that there would have to be certain timelines for implementing it. I believe that
There's one timeline.
I do the effective date here. The effective implementation is January 1st, 2016. So that's for the registry. Now, what I might include here would be an evaluation of the progress. That there would have to be an evaluation conducted of the implementation after 1 year, right? Or should it be 6 months? There are two types. There are two types of evaluation generally when we're doing research. When we implement something, we can do what we call a formative evaluation. After you have implemented it, maybe 6 months down the line, you will then evaluate it to determine the progress, if you're meeting those supporting objectives or the goals and where you are at in terms of implementing the program or the services. Then there is the summative. We have a goal of implementing this, and there are specific goals. So we would look at the number of people who are actually registered and interviewing them when they needed help, their needs were actually addressed, and whether the registry is doing what it was intended to do. So that's what we call a summative, whether the registry is actually meeting the needs of those individuals that we are targeting to provide services. So I can incorporate that in the bill so that we have a way of monitoring the implementation to see if we have to make adjustments.
Can we have ongoing evaluation? Because I'm concerned, these disabilities don't go away after a year or so. So I think we need to make sure, because sometimes programs, they start out well, but as they get going, it falls apart. So if we have some kind of a way to monitor.
There is a way. There are several ways. This is what we did. There is a, what's the term for it? One way to do it is to actually say this program is going to end at a certain date. And before it can continue, it has to be evaluated, right? So then you don't just assume the program is going. There's really going to be a time when there has to be legislation that has to be
To continue it.
to continue it. That's one way of doing it, to ensure that everyone is in the, you know, that it's actually being implemented, right? But I believe there's a way in that formative evaluation where you set timelines for reporting to the legislature.
Oh,
Yeah, the progress of the implementation, we can do that. Yeah, they have to submit a report about where they are at. And usually with the implementation, there are specific, they call it, what is it? You know, it's like milestones that have to be met, right, in the full implementation. So we can identify when those dates are, and then go from there. Yeah, but there are ways to work it in the language. Okay.
And Senator, we can include those milestones in a consumer satisfaction survey that people can fill out within that time frame. It doesn't have to be at the end. It could always be
Yes.
open
You can
anytime.
You can do that.
Yeah.
But I'll work on the language for that.
we need something on a
Monitoring.
continuous basis
Yeah.
that, so that, so that this operates and it's effective.
Right,
And-
and
and-
there's a way of monitoring it, so that the report would be made available to the legislature, of course, because we're funding it, but it would also be posted or made available to various stakeholders, whether it's DISID or the families, and different organizations.
So in the bill, when you talk about funding, this was a one-time funding. Is there going to be an annual amount that's going to be given to maintain this?
The bill right now, as it is stated, is, it's a startup, right? And from that point on, then the funding would have to be incorporated in the agency, right? That handles. Yeah, because would
Part
have
of-
to be put in the budget.
Part of the evaluation, if we were to go with like the barcode system, then you'd have to see, explore how much it would cost for the access to the apps, if there is a charge, or,
Right, exactly.
because we
That
know
would be
there's
all
a,
part of it.
yeah, we already know there's a voluntary annual fee for the members who want to put their information in there, and then what it would be on our end for that fee to happen. And then also for the build-up, if you're saying January 1st as the implementation date of the registry, then there should be, I say, milestones for the evaluations of education that goes out, because right now we're in an educational cycle for our EMTs.
Okay.
And it's a perfect time to start incorporating a syllabus for a CEU program to educate them more detailed on like the autism and the DISID, and then also about the registry and how it's going to incorporate and be used. And that way, when we do roll it out in January 1st, they're ready.
Okay, great. Okay.
So I would like to request that when you're gathering information about the autism and the needs of the persons with autism, both for DISID and for the first responders, that you contact the families as well as institutions who can give theory. We're living with it all the time.
Yeah.
So I think
You
it's
can
really
prove it.
important that you contact family members or meet with them to see what the concerns are and everything.
Well,
Right.
with the model that we're doing in our training bureau now is not just to be taking one of our instructors, do his research and book work, but it's also to reach out to the people that are involved in the community and have them come in and give a talk and be part of the education.
That's good.
That's even
Very
better.
good.
It's like-
That's even better.
Yeah. It's like Sagamanagu, we got special situations with Sagamanagu that is unique. So they've developed a syllabus and they're going to conduct a training course for our EMTs. And then we want to reach out and do the same thing with DISID and with the autism population and get that feedback, because if we get the individuals that are involved in the community, it gives more of a personal approach and personal information given out to the EMTs, and then they take it more to heart. You know, they'll have a better understanding in what that community, what the citizens need.
Okay. Very good. Well, we're all set? Yes, Sam.
I'm sorry, just one more. I just want to make sure that maybe we go in the program doesn't have to be necessarily in here, but just making sure that somebody's updating the information
Oh, okay.
on
On a regular basis. Yes, got it. Thank you so much, everybody. Okay, so this concludes our roundtable discussion. Very helpful, more work. But we want a bill that would really meet the needs of our people, right? So thank you again. And so this concludes our roundtable discussion. It's 11:10.
Thank you for asking.